Welcome back to Your Health, Your Choice with Dr. David. This is part 3 of our 3-part series on pediatric medical cannabis. On this show, over time, we're going to be covering a lot of the different areas of specialties that you have. Vaccine considerations. We're going to be talking about how to improve and optimize your immune system, and nutrition, and other areas of health and medical choice, quite honestly. One of your areas as a specialty in medical cannabis, we will have a series of shows that are on medical cannabis. And so obviously this particular show is talking about pediatric medical cannabis, but stay tuned, because in other episodes, we will be talking about such things as legalization of cannabis and how that may affect the medical cannabis movement. We will be talking about how research in this country in particular has been stunted as a result of the classification of marijuana as a Schedule I drug. So I just want to give a little bit of a preview of some of the other things that will come. We also will be having some of David's patients who will be joining us on the show, parents who are talking about the experiences that they had with their children, going through this with them, and why they chose to take this route. So we know from recent interest that the news has actually had in talking to you about this topic, that there are often two things that grab people's attentions: stories about kids, stories about marijuana. You put kids and marijuana together, and now you've got a lot of people asking questions and that are really interesting. And one of the things that a lot of people think is, wow, if you're doing that, you must be a really progressive doctor, right? Well, and a lot of people think of progressive in a certain way, right? And we're not talking about politically progressive right here. We're talking about the idea of progressive, which has as the root word progress, right? So why did you get drawn into, as a holistic pediatrician, as somebody who's already been working with herbs and have done other forms of more progressive, holistic, open-minded treatments? Why medical cannabis? Why are you seeing this? What's the value that brought you here?
And it's funny because I've also considered myself actually a rather conservative when it comes to doing medical treatments, because of the fact that I believe very much in the body's ability to heal itself. I believe that most medications that are written for children in this country are completely being used as a placebo effect and are not necessary. And I believe that it is conservative to go back to nature, to go back to how people have been treating for lots of years. And so it's an interesting choice of words here, because in a lot of ways, yes, we're making progress here, but we're going back to a treatment that's been around for 4,000 years. Okay. So for me, as somebody who, even going back to 1995, when I was so brilliantly taught at Tampa General Pediatric Clinics by one of my mentors, Lou Barnes, about the importance of B vitamin metabolism, the importance of breastfeeding, the importance of having a healthy gut microbiome, the good bacteria there, the applauding that we were done when we didn't put kids on antibiotics unnecessarily, when we were just able to watch them conservatively. That was the foundation of my pediatric training back in the 90s. Follow that up with, while we were there, a brilliant article came out in one of our trade journals called Contemporary Pediatrics, called 7 Herbs Every Pediatrician Should Know About. Because it was in this journal, I was allowed to start using them at Tampa General. So mid-90s at Tampa General, I was using herbs in the clinic on a day-to-day basis. And so this was such a foundational thing for me, because I saw the healing power of herbs. I saw the importance of nutritional deficiencies, vitamin D deficiencies and zinc deficiencies, how I can measure them, how I can treat them, how I can retest them to make sure that we're optimized. So again, this is all part of, we spell holistic with a W for a reason. We are looking at the whole picture. We're looking at the whole person, the individualness of every person. For all of the thousands and thousands of children that I take care of, probably none of them are doing the exact same thing as another one, because it's so individualized. So when it comes to cannabis, it's just such a natural, no pun intended, extension of what my entire philosophy has been for going on 25 years now. So to me, it's just, well, of course I do this, but the other important thing is I listen. Most of the treatments, the tests, the things that I've done have been things that parents have brought to the table. Hey, I heard about this. I'm not going to just trust this article. I trust you as my pediatrician. What are your thoughts about this? Is this something that you're comfortable testing for? Is this something that you're comfortable doing for a treatment? Let's work on this together. And then I would, of course, say to a parent, understanding that I do have a lot of knowledge. Obviously, for many of these things, at some point, I didn't have a lot of experience, but being transparent and open and let's work at this together, making myself available that if things aren't going quite right, that they can get a hold of me. If things are going right, but maybe they're looking for another step that we can seek, maybe we do want to increase these things. So I've learned more from parents than any medical conference, any book, anything, any lecture that I've ever attended, because as we're told, we have two ears and we have one mouth, and so if we're spending more time talking than we are listening, even though I know I have a tendency to talk a lot, but still the hearing, the listening is probably the most important thing that has gotten me to where I am today.
Well, and one of the other things that I think separates you from a lot of other doctors, and we've talked about this on other episodes, is your innate curiosity and your desire to continue learning. So medical cannabis as a field, right, as I mentioned before, because of certain limitations, has not been able to be explored academically as many other medications or many other treatments have had the ability to do. So I know that you have really, from the beginning, even before medical cannabis was legal in the state of Florida, because it was legal, like you said, in other states, was an area of interest of yours, that you would do a lot of research. And it's something that I see you continuing to do. So one of the things that I wanted to say about this show is focused on health, education, and choice. And the education piece is huge here, right? Because it's not just the education of the patients, of the parents, but it's the education of the physicians, right? And so is there guidance that you think you can give to other pediatricians specifically who may be listening to this show, who maybe have sparked a little bit of an interest here, whether they're in Florida or somewhere else, who might want to find some more information? Is that the type of thing that those people should be reaching out to you through your website, which is, by the way, drdavidmd.com? Or is there other avenues that you could potentially be pointing them towards, or that you'll be developing over time?
Yeah, and for those who don't know, it's actually drdavid. MD.com when you're trying to find us. Although nowadays, if you Google Dr. David or David Berger, you'll tend to find me anyway. But yes, so I'm happy to talk to other physicians about this. I want this to be a more mainstream understood thing. Physicians can come shadow with me if they want. We are talking about in the future, maybe we could put together formal curriculums, CME types of courses, etc. But for me, this is really about education and getting other physicians knowledgeable and comfortable and experienced with this. I mean, yeah, it's kind of neat that I'm the only person who's doing it, but that's not what I want. I want this to be a mainstream understood treatment, because the more physicians who are understanding this and are efficient and effective in treating, the more people that are going to be helped. There's a reason why we provide educational consultations. I have a lot of experience. So if a family says to me, hey, I have a child in this situation, I can certainly share, because when I lecture publicly, when I've spoken on the news in all types of venues, I can say, well, in a child who has these types of symptoms, this is what I've often found helpful for children like this. Now, of course, I can't provide individual certifications or a particular, you should get this product and this is the only thing that you should get, but I can explain about the terpenes, and I can explain about the cannabinoids, and I can explain about the delivery systems, which is something we didn't get as much into now, but I can certainly explain in those general types of terms, just like I've given in conferences and lectures all over the place, that would really be able to help a particular family be able to say, okay, now I know in kids such as this, these are things that could be helpful.
Right. And if the child is in the state of Florida, they have the option of traveling to Tampa, which is fairly centrally located on the West Coast, in order to be certified through you, or through one of the other doctors on our team who also work with children, right? We have several doctors on our team who work with doing pediatric medical cannabis certification in the state of Florida. But obviously not everybody can do that. And so we know that there are kids all over the state of Florida that are needing help, and parents that are wanting to see if this is a viable option for their child's chronic conditions. And they may have looked around in their area and not been able to find through the registry a qualified certifying physician in their area who's also a pediatrician who has this level of expertise. So one of the things that they are able to do is to get certified through whoever their local doctor is, because as you mentioned earlier, there's not even a lot of education that goes around that. They need to get certified to go in, do it legally. But there is also a way that they can reach out to you, especially in the state of Florida, and to access your medical expertise in this field. So that's something that I definitely invite people to visit your websites and get more information about. And over time, the hope is that the idea of medical cannabis, really for everybody of all ages, but specifically for pediatric patients, will become something that is not seen as, wait, you're giving weed to kids? And for people to not have that immediate gut reaction of like, there's something wrong here, right? So I know that you're hoping to play a really big role as you develop in Dr. David MD from an educational and media company in helping educate families who are not your patients, right? In addition to the families who are your patients, but also working with physicians of all types of specialties, right? Because if you have a pediatric oncologist and they have a patient coming to them, it would be really good if that pediatric oncologist had knowledge that this would be a good thing for them to look into, even if they're never going to become a certifying physician themselves. We would hope that really they have a moral obligation to have this information so that they can be educating and really giving all of the options available to their patients. And that's one of the things that we've seen a lot, is that that sometimes doctors are so in their sort of echo chamber of what they're taught in medical school and what they're reading in their more mainstream journals. And a lot of times medical cannabis is not even in there. So there's not even necessarily this idea that pediatric medical cannabis is a therapy that can be incredibly beneficial for neuropsychologists who are doing evaluations of children with ADHD and other attention deficit disorder types of things. It's really important that those other fields know that pediatric medical cannabis is a legitimate medicine and that it's very important to work with somebody who knows what they're doing. So I very much encourage people to continue going down that path. Is there anything else you'd like to share before we wrap up today?
Well, no, and kind of like just leading off of what you just said there. The interesting thing is I have been getting many more referrals from pediatric neurologists, pediatric therapists, from even pain doctors in the non-pediatric world. Realistically, I'm getting more referrals now than I ever did in holistic pediatrics and family care for the other stuff that I've done. In fact, even within the medical community, I mean, people now are hearing the good work that we're doing, that I kind of joke around that, for me, medical cannabis made me legit in the medical field, which is kind of funny as all anything, that of all things that this would be it. But, certainly I tell people, if you would have told me 10 years ago that I'd be doing this right now, I would have asked you, what are you smoking? Because, there was just so far and beyond the thought that this would actually be something, and that I would actually be able to do that. I knew I would be good at it because that's how I am with natural things in general. But it has become just such a blessing, the number of kids, the other physicians that I have been able to help, because I'm able to add that level of support that they don't have.
Yeah. So everybody stay tuned for further shows where we're going to dive much deeper into the topic of pediatric medical cannabis. As I mentioned earlier, we're going to be speaking with parents who are advocates, parents who have really, because one of the things we didn't really talk about, but we'll do a show on it, right, is that the leaders in the pediatric medical cannabis field, as you sort of mentioned earlier, or alluded to, have been the parents, right? It's the people who are seeing that certain more traditional mainstream approaches are maybe not working anymore, or maybe they're completely failing their kids, or they're not optimizing the treatment plan in general. So I look forward to us having on future shows some of those parents who have been really at the forefront in the state of Florida of bringing this conversation to everybody. And we look forward to seeing you on future shows. Please make sure to subscribe to this channel. We have other offerings as well, and we look forward to seeing you again soon.